See, the Southeast Asian population is more prone for cardiac diseases in the form of coronary artery disease, which leads to heart attacks. So a genetic predisposition of us to have higher rates of heart attacks is already there. Along with that, your question was, in the post-COVID era, you are seeing more heart attacks. Yes, there is like after the COVID and after the infections which used to happen, which has happened for a large number of population, we have been seeing high number of heart attacks. See, the basic etiology, the main cause of a heart attack is 100% block of the coronary artery. This has been happening for many years. So related to the causes, multiple are there, from added stress, change in diet, change in habits, high carbohydrate intakes, some of them having heart attacks in gyms. There are multiple causes of these. There are some congenital heart diseases which cause heart attacks, or some congenital problems called hypertrophic cardiomyopathy that causes heart attacks in young people. Apart from that, coronary arteries getting blocked in a younger age now is being seen very commonly, more because of inflammation in the arteries. The routine fitness is always related to heart, the endurance level of the anybody who is having a sedentary lifestyle, who is not having a active lifestyle, is more prone for heart problems. So exercise is very essential. You see in Japanese population that you have people having lesser heart attacks or higher life expectancy versus in our population. That's because of their daily from the education, from the primary education, school, all these, they are having a particular fixed schedule for fitness, and fitness is encouraged as a culture. In our country we have to still get to that phase, in spite of we having now developing more in sports, also with having Olympic medals. As a general population, that there should be encouragement of sports and activity as a routine for everybody from school. So if this is inculcated in us, more fitness level is there and we grow into fit adults. So the focus of now, with the present problems having more heart attacks, the focus is prevention, that you need to focus on how we are going to prevent in the next generation more heart attacks. These are the main contributory factors, apart from genetics, which you cannot change. As I said, Southeast Asian population, Indian population, prone for heart attacks. Okay, this is what you cannot change. You are born here. Now the next one is what you can change. What you can change is prevention of diabetes. Yes, increased number of cases in diabetes, increased hypertension, increased stress, change in lifestyle, change, urbanization. You know, people are getting into urban routine. Villages are getting urban. In and across Bangalore, you have so many villages which has become urbanized. So all these contribute to increased stress levels, increased hormone changes, sugar spikes, change of food habits. What your great grandparents were eating or grandparents were eating, we have changed our routine. We are going into simple carbohydrates which spike the sugars. All these causes atherosclerosis, inflammation. Inside the artery, if you have inflammation, you have chances of more heart attacks. So definitely the rise in sugar, blood pressure, all these contribute to heart attacks. So prevention is the key. Now mental health is a very large terminology. In our culture, in the Indian subcontinent, unless it's very pathological, general problems of depression, stress, anxiety has been low because of our ability to stay in joint families and ability to have better social culture. Now if we leave those things, if we are going towards a different lifestyle in which more we are becoming more nuclear and we are attached to more social media via towards the society, this has caused increased level of stress for a lot of people. And this definitely we see that the people who are coming from the IT background or younger population, this has definitely contributed to them having heart attacks. So I recently came across one patient in the family at 40 years old. I'll tell you the story of this. Very interesting story. My wife's cousin, she wants to become a doctor, but she chooses not to become a doctor and becomes a engineer. Her husband has a chest pain while walking, and they think that he's young, 35 years. So they think that chest pain is there, gastritis. But still, the girl was having so much presence of mind and mindfulness of the problem of the husband. She gave aspirin tablets, 2 tablets of aspirin, and afterwards he said, "Okay, I'm okay, fine." So they did not get the man checked. Again, after a couple of days, again he was having chest pain and he had a heart attack, but the heart attack was limited. They came to the hospital, we did an angiogram, and whatever treatment was there, we went through the treatment. But what I want to bring here is the presence of mind of the person in the family, recognizing an early symptom of chest pain. So symptoms of heart attacks are like chest pain, shoulder pain towards the left, towards the jaw, towards the back, or this suddenly it can come, or during exercise or during exertion. The other one component is breathlessness. If you are having breathlessness, not able to walk, the amount of walk you were doing earlier, so these indicate that your heart is asking for more blood. These are early signs and symptoms. You have to have a point of contact, primary care physician, that has to be developed in the social cultures. You have to have a physician close to you, a friend, a doctor. Once there are guidelines, once you are 40 years, you need to get yourself checked. Your echo has to be done, your ECG has to be done, maybe your TMT might be advised. But you have to go and get your blood test routine, and over that, if there are some symptoms, some family history, people are advising CT coronary angiogram, that can be done, but all that has to be done through a doctor. So there are definitely tests which will prevent, which will make us aware of our heart condition. Over that, we can continue to do our exercises depending on our heart ability and function.